Is psychological debriefing effective for everyone? When it comes to psychological debriefing, many wonder if it is effective for everyone after a traumatic event. Psychological debriefing is designed to provide emotional support shortly after trauma, aiming to reduce the risk of developing post-traumatic stress disorder, commonly known as PTSD. However, research shows that this approach is not universally effective and may not prevent PTSD or lessen psychological distress for all individuals. Extensive studies and reviews indicate that single-session psychological debriefing does not significantly lower the chances of developing PTSD, depression, anxiety, or other mental health issues following trauma. In fact, some evidence suggests that it might even increase the risk of PTSD in certain individuals. One systematic review highlighted that there was no benefit in reducing PTSD risk 3 to 5 months after trauma, and it noted a potential increase in risk at 1 year for those who had received debriefing compared to those who did not. This has led to recommendations against compulsory psychological debriefing due to its lack of effectiveness and potential harm. The limitations of psychological debriefing stem from its one-size-fits-all approach. Trauma responses vary greatly from person to person, and some individuals may need more personalized, ongoing support rather than a single debriefing session. The unpredictable nature of trauma events also complicates the delivery of standardized debriefing, raising ethical concerns about withholding support from control groups during research. Recent analyses that include a wider range of study designs have not consistently supported the effectiveness of debriefing either. These analyses suggest that factors like adherence to established debriefing models, session length, and facilitator training play a role, but no clear consensus has emerged that psychological debriefing reliably prevents or reduces PTSD symptoms. Current expert consensus and clinical guidelines advise against the routine use of single-session psychological debriefing for all individuals exposed to trauma. Instead, a screen and treat approach is recommended. This means monitoring individuals after trauma and offering evidence-based interventions if symptoms of PTSD or other mental health issues arise. This method allows for personalized care that meets the specific needs of those who are most at risk or already experiencing distress. In summary, psychological debriefing is not effective for everyone and should not be seen as a universal early intervention after trauma. While it may provide some emotional support, it does not reliably prevent PTSD and may even increase risk in some cases. Early intervention strategies for PTSD focus on targeted assessment and treatment rather than mandatory debriefing for all trauma survivors. If you or someone you know has experienced trauma, it is essential to consult a healthcare professional for personalized support and guidance.